Happy Tuesday, Ability. Today I want to build off of what we talked about yesterday in the interconnectedness of the nervous system with talking about why it's important to get adjusted and what each adjustment can provide. One of the best ways to describe this is using one of Heidi Horvick's studies in which she talks about an overactive wrist in a patient and then consequently a weak thumb. And they looked at the way the muscles fired or were contracting and relaxing before and after a neck adjustment on this patient. They had that dysfunction beforehand, and afterwards, after one cervical adjustment, they saw that the forearm muscles that were overcontracted previously started to relax, and then those thumb muscles that were too weak to begin with started to have more contraction. In other words, the joint started to balance itself out, and of course it starts to feel better as a result. Which goes to show you, if the chiropractor who saw somebody come in and said, my wrist hurts, my right wrist is doing something odd, and only address the wrist instead of realizing it's all connected and we better look at how that neck is functioning, and didn't give them a cervical adjustment, they would not have had the benefit of the brain talking to the wrist and telling the wrist and the thumb when it's appropriate to contract and relax. So take that scientific study, relate it to the way the nervous system connects the brain and the body holistically, and educate your patients on why it's so important to address the entirety of the spine. Have a great Tuesday.